Cool. So we've got Melnard on the podcast. If you don't know him, he's all over Instagram. He posts some really good content about injuries, around powerlifting, those sorts of things. He's a coach himself. He's just graduated from physio stuff. If you don't know who he is, we'll just ask him now and just get him to tell us a little bit about himself. So for those of you who don't know much about you, Melnard, give us a bit of a rundown of who you are, what you do, those sorts of things.
Yeah, for sure. So I'm a powerlifter, powerlifting coach, and recent physio grad. So as a powerlifter, I've been competing since 2015, and as a powerlifting coach, I got started with that in 2017. But then later on, right before I got into physio school, is when I really started wrapping things up and taking things more seriously. And I just finished physio school, so I'm in this weird period now where I'm considered a new grad, but I don't have my full license yet. So I just wrote the first part of my national exam, and that I passed that. And so right now, if start work, I'm considered a physio intern, but I haven't started work yet. So I guess the most accurate term right now for me is just a physio grad.
Yeah, okay. So how does the the licensing sort of component work over in the States? Because it'll be completely different for us here in Australia. But so you do your physio degree and then you have to do further education or apply for some sort of license to practice as a physio?
Yeah, um, so I'm from Canada, and the way we do things here is during our actual schooling period, we write the first part of our national exam, and that's just like a written component. It's like a 200 question multiple choice test you on like pretty much everything. A lot of the stuff is outdated, but it is something that we just have to get by and pass. And then after that, you pass that, you can now start work as a physio intern. So the way it used to go is you typically go through this period of working at anywhere between like I believe it was like four months to like over a year, and then as you work, you consider as you intern, and then you just wait until you can until there's an open seat to write the second part of the national exam, which is the clinical portions, the hands-on stuff, testing your manual skills and things like that. It was a weird thing here in Canada where things got a bit messed up because of COVID. So there was a huge backlog of people that finished the first part of the national exam, but then um, they're all waiting to write the second part. And what ended up happening is there's just such a huge backlog that they just abandoned the second part altogether. And it was like the national governing body that does the regulatory exams. They're not really well liked at all, but they essentially left it to each individual like area to decide how that transition period is going to go from like an intern to becoming fully licensed. So in my area, we're still keeping a clinical exam, and we don't know when the next date is yet, but the rumor is either earliest probably sometime this summer, or it could be up to like end of October when we can finally write our exam. And I know like a neighboring province, for instance, they already have dates to write the second part of the national exam. I think in February I have some classmates already writing it. So yeah, it's a bit of a convoluted process, but essentially we pretty much have most of the like as a physio intern, you pretty much have all the basic skills that you need to practice as a physio. You just need some supervision, but I think in practice people aren't actually being supervised that well. They just get like a 1 or 2 week orientation, and then they're off to their own devices to build their own caseload and everything.
Yeah.
Pardon?
Yeah.
Yeah.
How do you get the internship? Do you have to apply for it or is it through the university itself?
Yeah, so pretty much the way it works is after you finish everything, you essentially just apply for whatever job that like wherever you want to work after graduating. So your actual like your adult job now. And then after you do the interviews and you get the job, you find like a supervisor in that role. So someone signs your name and they fill out the registration, and then you can actually be registered as an intern. But for me specifically, I haven't started work yet because I wanted to focus on kind of my own thing for a bit. So uh, I don't have like a supervisor at the moment, so I can't really call myself like a physio intern, but I could if I want to. Like I'm definitely in a position where I can just go and apply to um just like a physio clinic or even like a inpatient physio opportunity and then just already start work. But for me, I have just some other things that I want to focus on first, specifically like powerlifting coaching, and so I want to make sure that I kind of get a lot of the stuff that I'm working on um, done and have good systems with everything. Because something I found out during the tail end of physio school when I was doing my final clinical rotations, and I was doing my final clinical rotations, and I was prepping for a meet, and I also had my existing um, lifters that some of them were doing meets as well. And then I also was creating content on social media. Something I kind of realized is trying to balance everything at once is really tough. And I think that's the reason why there's not a lot of people doing it. And so I realized that if I'm gonna get to that point again, then I need to kind of create things and create systems to actually make that more sustainable so that way I'm not just like dying with no sleep every single night trying to make ends meet.
Yeah, for sure, man. I relate to that heavily around my last uni semester as well. When it comes to like those final exams and there's meets and you're coaching and all the rest of it, it becomes a huge struggle. So I completely relate to that. So are you like, I guess in your experience now, do you do a lot of your own lifters rehab like now as like a I don't know what to refer to you as. You're not an intern physio, but as a physio grad, do you look
Yeah.
after a lot of your own lifters' rehab needs, or do you still just sort of focus on the coaching and refer out when needed?
Yeah, so this is kind of like the gray area of things where obviously because I have like my physio background and stuff, if one of my lifters during like a meet prep, for example, they get hurt, I'm not just suddenly gonna be like, hey, I'm just a coach. I can't use my physio skills, right? It's like there are some things that I kind of do to help work around aches and pains, and it could be specific rehab exercises or just modifying their programs based off whatever they need. It kind of really depends on the situation, but I guess to answer your original question, yeah, I am kind of involved in the rehab of my own lifters, and um there are like obviously I do kind of ask around to make sure this is a case or an injury or something that I can handle myself. I don't need to refer out and for something else. But yeah, it's a lot of it. I am pretty involved in a lot of my clients
Are you doing
rehab and
that,
stuff.
or is it in person that you're helping your athletes?
Yeah, so as of right now, the majority of my clients is actually pretty much all my clients. They're when I'm helping them out, it's all done online. At the time when I was still at school and training at my university's gym, I was spending I I was spending like long workouts at the gym because my clients would also be there, and then if they run into issues, then obviously I would like take a quick look at things and see how they're doing, and maybe I can give them something quick to help them out then and there. But a lot of the times, most of my lifters, I like when I do my check-ins, it's pretty ongoing. It's like an open line of communication, and so I don't have like a structured weekly check-ins. It's more so after each workout we kind of converse and talk about things. And so I get a good grasp of how each of my lifters are doing, and then if they have any kind of aches and pains that kind of pop up, it's usually in that period of time where I'm receiving their check-in, and I'm just like at home and they just finished their workout, and this might be like several hours later when I'm finally getting around to them. So that's pretty much most of my lifters and how I kind of approach that.
I know Chris and a bunch of the exercise physiologists that we have here at Performotion. They run Zoom sessions for I guess rehabbing lifters, general populations, all that sort of stuff. Have you ever done anything like that, where you sort of sit in a Zoom call like we are, and get people in the gym, watch them move, and then I guess like do your assessments virtually and your prescription as well? Or are you more so like, I don't know, through WhatsApp or Instagram, like you've mentioned before, where you're just sort of conversing, going backwards and forwards, and prescribing things that way? Or have you done it live and virtually, like Chris has done?
Right. So that's a good question. I definitely have done a mix of both. So typically with my own clients, because I'm so involved with them and I'm communicating with them on a daily basis, we don't necessarily schedule a formal time to kind of sit down and troubleshoot things. But there have been some times with someone that, like one of my own lifters, when they're dealing with something and I need more information, that we schedule a time and then we do kind of like a more of a remote um, rehab assessment and and something more similar to kind of what Chris is doing. There have been some times where, because I am at my like university gym, sometimes if I'm there in person, I could do a quick like range of motion test or whatever and get a good grasp of sort of the movements that they're able to do and not able to do. But I actually have done uh, kind of like consultations of, for example, lifters who they're experiencing aches and pains, and maybe they're working with like another coach, or maybe they just found me, and then they kind of want my opinion on things. And the way I kind of go about this is I want to make sure that it's they're kind of clear that what I can do and can't do, it's fairly limited. Like, for example, if it's something that's more acute, I I just mentioned that maybe they should see someone local to them first. But more commonly, I see people who they reach out to me because they've worked with a lot of local physios and they made some progress, but they pretty much stalled. Like, for example, I've had someone who he's I think he's like a he squats over like 220 kilograms and he's dealing with low back pain, and he's made significant progress with the physio in his area. But they found that when they approach certain intensities or workloads, that suddenly he's not able to handle that, and then his back pain kind of flares up. So it's really cases like this where I feel like I can do much more, because a lot of that that might just be a matter of the transition um, between rehab and getting back to performance. And maybe like even though he does have a coach, maybe just there's some programming things there, or maybe they need additional exercises to improve specific capacity and whatever ranges of motion they're lacking, or if they need any additional exercises or stimulus that they're not getting from just like the main three, for example.
Okay. And Chris, like, what's your take on the whole virtual sessions? Because I know you run a few of them yourself. Do you find the same sort of thing where like you prefer people to do the acute stuff with the physio in person, and then you like to take over if it's more long standing? How do you sort of, I guess, run things in comparison to Melnard?
I think ultimately it comes down to what the person's reached out to you for, right? So I guess there are some things, I guess, for us anyway in Australia, our exercise physiology scope is a lot different to a physiotherapist scope. Even though we do very much the same thing, except the physiotherapist just diagnoses and does a bit of massage as well. So I guess in terms of what we can actually do in terms of helping the client, I don't think it's very different. So I think we can definitely look at assisting the client from the acute period all the way to the chronic issues as well. So I know for me, for example, I've dealt with a lot of clients that do have these acute issues and it's literally a one session fix. But then I've also had those clients that, are a little bit more long standing with those, I guess, more chronic type, like your low back pains, your chronic knee pain, things like that. So I guess in terms of doing them online as well, if they have had no luck with their local health professional, then by all means, more than happy to see them. But even if I am a first choice, then same thing. I don't necessarily need them to go get a diagnosis, because more times than not, if they can tell me what their symptoms are, then we can more or less deduce from what their symptoms are and fix the issue without needing an essential diagnosis, if that makes sense.
Yeah, for sure. It makes heaps of sense. So I guess we'll ask both of you the same question, because I've actually never asked you this before either, Chris. But I guess we'll go Melnard first. But what got you into physio in the first place? What made you decide to study that? Was that as you got into powerlifting, before you got into powerlifting? Was it something where you were like, powerlifters get sore a lot after being in the sport, and you saw a market, so you decided to go down there? Like, what was your, I guess, your thought process, or why you decided to actually get into it in the first place?
Yeah, so that's a good question. I would say coming out of high school, um, it's funny because I was mainly I I was more like a math and physics type person in high school, but high school was around the time when I first got started into lifting weights in general, and then from just started off just following bodybuilding routines online. Eventually, I stumbled upon strength training, and then I came across I believe it was Strong Lifts 5x5. It's one of the beginner programs. And then yeah, so I ran with that, and I thought that like, okay, if I just keep adding 5 pounds every single week and every single workout, I'm gonna get really, really strong. And then so I just kept pushing and pushing, and even though the workouts got progressively more difficult, and I was just like dying to just finish my all my sets of five at one point. Um, eventually, like what happened was I hurt my back just from all the overuse and not knowing any better, and my technique was probably not the greatest either. And what happened was initially I went to just like a walk-in clinic to kind of get get checked out. And oh yeah, and it wasn't just like a regular back injury. It was actually I believe it was, yeah, it was sciatica. So I was getting sharp shooting pain down my leg. And then for me, I was just like, okay, what is this? I've never felt anything like this before. Like, what's going on? And then I went to a walk-in doctor, and I think he just said it was like he thought it was just like he saw me for like a quick 5 to 10 minute assessment and thought it was just like a muscle spasm or something. And it was like, hey, try taking these muscle relaxants, but you could also check out a physio. Maybe they can help you out. And then walking out of that, I just remember feeling that, okay, there's probably something missing here, and I feel like I wasn't assessed properly. So then I went to see the physio, and then this is my first experience with physio because I actually haven't played like that many sports growing up, so I haven't had that many injuries. And so it's my first experience with physio. And then that first session, he did a full assessment. He found kind of the movements and positions that triggered my pain, and then he explained everything to me. And he knew that I was just like I was just taking like biology in like high school, and I had some of the fundamental sciences there. So he's actually sat me down and explained everything, and how like how this one nerve root how this one sciatic nerve is irritated. And then I thought that was just like really, really cool at the time. And then he gave me some exercises, and then we were working together. And then this is kind of when I realized that, oh, you could use exercise for like to heal yourself and to feel better. And it's interesting because something I was considering, because I was getting more and more interested in the biology side of things, was medicine as well. But then just something about that experience where on one hand, this one doctor saw me, and then he gave me this like or essentially prescribed me some muscle relaxants, versus a physio, he like took the time to understand what I was going through, and then gave me some exercise. And it ended up being like exercises was and the idea of just like being prescribed exercises, and that being how you kind of heal and feel better, that was just like mind blowing to me. So I was like, hey, this is really interesting. And then as I pursued a university, I learned more and more about the different things, and I realized that I was more suited to um, study physical therapy, and I like the things that they do with exercise and movement, and the types of assessments that you do, as opposed to medicine. So that's how I ended up there.
Oh, that's cool, man. What about you, Chris? How did you get started with it?
So I guess originally in year 11 and 12, or high school as they call it in Queensland here, I initially wanted to be a physio, but because I was doing so much sport in like throughout my, I guess, years 7 to 12, I didn't really pay that much attention to study. And as a result, I didn't really get the grades that I needed to get into physiotherapy into university. But I ended up going into like, I guess, exercise science. And then throughout exercise science, I've sort of had really no direction in terms of what I wanted to specify in, because exercise science, I guess, is quite broad. I found it was, really no direction in terms of giving you an avenue to specify in. And then one of my mates was doing exercise physiology and rehab, and he said, sort of sold me the idea that it's more or less like a physio, but without the diagnosis and the massage and everything like that. And when you look into it and see the scope of practice, that's more or less what it is. There's no real gray area outside of, we can't massage and we can't diagnose. And I guess more or less from that, I sort of, went and transferred across into EP, and here we are now, I guess. I guess the big reason as to why I've wanted to do EP or something in terms of this health profession is because having played sport so often and being somewhat injury prone, playing rugby for quite a while, it's always been fascinating to me to be involved in some capacity in sports, whether it be field sports or barbell sports. So I guess have now more or less recentered my ideas and my passion, you could say, into helping people perform without necessarily needing to hold them back. Because I find quite a lot of the time that, similar to your situation, Mel, where you were talking about the doctor just prescribing a muscle relaxant and saying on your way, a lot of other health professionals may do the same thing, where they'll give you, just a specific isolated exercise. For example, if it's a shoulder pain issue, they may give you, 3 sets of 10 on external rotations and say, this will do the trick. But more times than not, it's something a little bit deeper than that. And I think that it being able to identify that and integrate it well into the program is what I'm really enjoying doing, to make sure that athletes aren't stopping their training and aren't having to be felt like they're not progressing or they're being held back. If that all makes sense. I know there was a little bit of a all over the shop story, but that's more or less where my thought process is at with all of that.
Oh, that's cool. I like that. I guess some people may not know much about Leanne either, but Leanne's not currently studying, but was studying. Just put it on hold after getting halfway through. If you want to, I guess, fill everyone in on what you've been doing.
Yeah, so I graduated from Bachelor of Exercise Science, and then I started doing my DPT. So I got a year and a half through, and then I've decided to defer this year just to kind of pursue my coaching and training and things this year, and then get going with it when I feel ready to go back.
For those that don't know, what is DPT? What does that actually give you from the exercise science degree and going into this?
So a DPT is Doctor of Physiotherapy, so similar to what it is in the States. So pretty much you graduate as a registered physio in Australia, but you can go over and work in the US as well. Yeah.
Cool. So yeah pretty much all linked to the same areas roughly and loosely. But as far as your physio work goes, are you looking to eventually end up in a clinic? Are you hoping to work more online? I guess something similar to what Chris does. What's your sort of target demographic? Are you looking to just rehab powerlifters, all general populations, all sports? Do you have any sort of idea of where you want to take your whole physio thing in the future? Or is that sort of like an afterthought because you're so focused on your own coaching at the moment?
Yeah, so in terms of my target demographic, the population I'm most interested in helping is, I guess you could say, like the active Gen Pop people that are involved in some capacity with lifting weights. So anywhere between just like the average weekend warrior all the way to people that are looking to be compete at a high level for like powerlifting, for example. And so, and the way I kind of see that breaking down in terms of like in-person versus online stuff is eventually I do want to work in a clinic that does focus on this clientele a bit more. And at the same time, I'm still planning on pursuing my own like online powerlifting coaching on the side. And so just a combination of in-person like physio, online powerlifting coaching, and then the other thing I want to do is kind of the combination where it's like online, more of the way I kind of see things is it's more of like a return to sport type a service where you have someone that maybe they worked with like a physio before and they just need the help getting back to where they were doing, because maybe they don't get any but maybe they don't have any back pain anymore, for example, but they're like like a 300 kilogram squatter, and their coach doesn't have any specific experience taking someone who maybe hasn't even touched over 100 kilos in like months all the way back up to 300 kilos. So it's like, this is something I feel like with my skill set, I can kind of help bridge that gap and take someone who um, is in that situation and might not have too many other like options, because it's a very niche kind of um, service.
Okay, that makes sense. Do those sorts of clinics exist where you are, or would that be something you would have to move for? Because I know where we live in Queensland, it's kind of like powerlifting is relatively small in Australia anyway. It's kind of niche still. It's growing pretty rapidly, but the sort of, I guess, gym clinic sort of area that we work out of is quite rare to have performance and rehab under one roof, at least to the sort of level that we take it here. Is that something that you have in your area, or would you have to travel to, I don't know, either a different part of Canada or to the States, for example?
Yeah, so um, actually, I'm lucky where I live. There's a decent powerlifting scene. We actually have a bunch of more powerlifting or barbell sport oriented gyms that are starting to pop up across the city, as well as like this other city that's just a 3 hour drive away from me. And actually, what's happening now is we have these gyms where, um, so I don't think we have anything quite similar to what you guys are doing there, where everything's all the services are integrated, and you have the gym, and then you also have like exercise physiologists and the physios. But what we kind of have instead is we have these gyms that they contract the space out to like physios or like other or some clinics, for example. They're like partnering with these gyms, and you kind of get this situation where you have like the rehab clinic, but then you also have access to all the gym equipment and some powerlifting stuff. So it's not quite similar, but we do have something of the sort.
Okay, that's cool. Um, I guess like moving forward, like what's been your experience so far with working with either your own clients or people that have approached you? Has that been like a bit of a steep learning curve, actually, in taking it out of the university setting and coming into, I guess, like more real world situations? Has that been challenging, or has it been pretty seamless to move from the more theoretical stuff to actually dealing with it in person when you've got a person that's actually in pain in front of you?
Yeah, so it's been a bit of both. Like I feel like my having the lens of a powerlifting coach and a powerlifter, that helped kind of shape the way I see rehab. And it in a way, it helped me when it came to, for example, patient education. I can use like a lot of like lifting analogies, and patients seem to understand that really well. And the other thing that it's been really helpful for is just knowing how to kind of adjust and scale exercises depending on a person's individual needs. Because here in Canada, in terms of our physio education, we do receive just like a very basic like musculoskeletal um, like education, and it's like really useful if you just want to help someone who's maybe like n- not particularly super active, and they can benefit a lot from just like some of the basic exercises. But where it kind of falls short is when you have these people who are more advanced, like competitive powerlifters, for example. And I think that's a population that, because of my experience, I do have the tools to much better help compared to just like the an average physio grad coming out of here. I think the more interesting part was kind of how you navigate different personalities, because it's not just about whatever injury or pain or condition that someone's dealing with, but also what how they're like as a person, what their lifestyle is like, what, are they a student, are they working, do they have a family, are they like super stressed, things like that. And then so it could I've definitely ran into situations where it's like it seems like the solution is these very basic things, and nothing really advanced from like an exercise or like a treatment standpoint, but just the fact that they have all these other life stuff going on, it complicates things, and you might need like to refer out and just give them other services that might help them deal with like life stress, or kind of come up with solutions to balance some of the other things that they're dealing with on top of their injury.
Yeah, I love that. That's completely overlooked by a lot of practitioners for sure. Is people aren't just robots. They're not just a mechanical piece of meat. There's a lot more to them than just the physical side of things as well. So that's really cool. Have you had any really tough cases you've dealt with where you've either had to refer out or it's taken you longer than you'd like? Anything that's, I guess, really challenged you and I guess made you grow as a practitioner or a coach or anything like that?
Oh yeah, 100%. I feel like every single clinician has their own kind of fair share of challenging cases, and I actually just recently listened to a podcast where it was some new grad physios talking, and they said that if someone seems like they have like all the answers, they probably don't. Like everyone, even like the most brightest mentors that this particular individual has, they have their own kind of cases where they've just been stumped as well. So on my end, one case that comes to mind is one of my lifters. Actually, he's so he originally was nominated for IPF Worlds. He's a high level 74 kilo competitor. His best total is a 7.5 kilo total, and that's also with like room to spare on each of the lifts. Like it wasn't a we didn't really empty the tank on the competition that he did that, and so we were on track to kind of breaking the total record, and he did have the junior record at the time here in Canada as well. But anyways, he was nominated for IPF Worlds, and training was going really really great. And what ended up happening was we found out that he didn't meet one of the nomination criteria. He wasn't, I think in particular, he didn't have his full Canadian citizenship yet. He was actually getting it. He was actually getting his citizenship later that year, but he didn't have it right then during the application process. So he couldn't obviously compete and representing Canada. But because we no longer had this constraints of this meet that we're gonna do, this particular individual, he's the type of person that loves pushing himself at the gym. So he began doing more and more kind of like gym stunts. So things like doing like a flat dumbbell bench, but instead of using dumbbells, he has two barbells, and just like deadlifting as much as he can cold, things like that. Like obviously I'm not programming it and I'm discouraging it, but he's looking to have some fun in the gym, and eventually things caught up to him. We ran into a situation where um he was like cutting down, and so he he normally walks like, yeah, so he was trying to cut down, so he was in a calorie deficit for a long period of time, and there was a string of several training blocks where he didn't really follow the deload properly. He he was feeling pretty good, so instead of kind of pulling back, he would just try to like push things. So he'd follow like the sets and reps, but he wouldn't drop the intensity. And then like, but he was recovering like great at the time, so it didn't seem like anything that I needed to um like, obviously I told him that he needed to to actually dial things down and recover, and told him that like, hey, this is you eventually it's going to catch up to you, right? And eventually it did. So it started off with an adductor strain, and that wasn't too bad to rehab. It was just a matter of like um dialing his load back and finding out the appropriate intensity and volume that he can tolerate, and given some other additional adductor exercises, and it was like a very minor strain. But then later on, he developed low back pain, and so originally we tried more of like a load management approach and just adjusting things, and we were making progress with that. And we found that, for example, one of his more tolerable pulling variations was an RDL, and he was feeling really, really good one day, and he actually went about 30 kilos more than the weight I suggested, and he ended up straining his glute.
Oh.
and, and and then because of that, and once we got that better, like we did have to take some time off from squat and deadlift, but because of that, it's almost like we undid that progress. So now, previous weights that he was able to tolerate with his back pain, suddenly they were becoming symptomatic. So he had to scale things down all the way, and well, not all the way, but like significantly more. And he is someone who very much loves pushing himself at the gym, so this did not sit well with him, and he I actually sat him down one day and I told him that, like, okay, we might need to modify what we're doing and change up your training split. Like, are you opening to changing your training splits to just help progress your rehab a bit better? And he said no. He wasn't open to training, because this is someone who very much enjoys the process of training hard over the actual like outcome. So he'd much rather just be able to push himself at the gym day in and day out, even if it means taking longer to get back to where he was strength wise, because his goal isn't to get as strong as possible. It's just to push himself at the gym. And then he's like, yeah, with time. I think the thing that didn't help too is we were making progress in spite of what we were doing. So I even told him that this isn't the way I would go about things with a typical client, but it doesn't seem like you're like it's completely not working. Like there is some, even though it's slow, progress being made. So are you okay to do this like the hard way, even though it permits, even though it means it's going to take you much longer to get back to where you were? And he's like, yeah, sure. So that was the case, and it was challenging because I feel like it was very much more the individual that was trying to that was holding things back rather than the actual injury itself. And it was interesting because um he we oh I just remember another thing on top of that. He also developed an inguinal hernia.
Oh.
So for those that don't know, that's it's different from a disc herniation. So an inguinal hernia, it's like when part of your intestine protrudes out of your abdominal wall and you need surgery for that. And yeah, just this entire period of like probably a good portion of last year was just spent adjusting things and making progress, but then having to dial things back. And so it's been frustrating, but things are now on the steady increase, and where he's actually not too far off from his previous strength levels. So that's been we managed to we managed to get there despite everything somehow.
Something about 74 lifters and just refusing to take their foot off the gas is like unbelievable. That's
Yeah.
They just keep going. So Melnard, I guess in powerlifters, right? Because we do a lot of squatting, a lot of deadlifting, a lot of leg drive with bench press. It's pretty common that we see that we see knee pain, right?
Yeah.
I guess in your experience, have you dealt with this quite a lot, or I guess what's your experience with knee pain and how do you approach it?
Yeah, so typically well, I've seen knee pain cases in the context of just like, a general pop, like typical sports injury, but more so within lifting, the type of knee pain that I tend to see is more just like anterior knee pain related to just overuse. So in particular, just like because you're pushing squats and deads, and it's not uncommon during like highly stressful training blocks or leading up to meet that lifters start to develop being this knee pain. And so I've had various experiences with it. I've had very kind of like minimal intervention type knee pain where, for example, someone at the gym, someone in the powerlifting club, a non-client of mine, I recall he was saying he was just following just a regular template program, and then he started developing some knee pain. But upon further questioning, it turns out that like over the past weekend, he was away on a trip, and suddenly he was clocking like 30,000 steps a day. And so I told him, okay, so it seems like you're in your case, it's probably less to do the program, and that the fact that you're not having the volumes, but the fact that you had this kind of like acute exposure to all this additional stimulus that you weren't having before. So I just gave him some advice on how to adjust his working weights, because that's a problem with the with templated programs is they don't really give you much on that end. And then I see him a week later, and he's like, oh, knee pain isn't there anymore. And so I've had, that was like a very easy and straightforward cases. I I've definitely have had more complex cases, or like more, I guess, debilitating knee pain cases. For example, I made an Instagram post on one of my lifters who leaning into meet, and he just all of a sudden developed this very sharp, like 7 out of 10 on a pain scale knee pain that prevented him from squatting any more than like 70 kilos. And so yeah, that was a bit more challenging, and we needed to do more interventions from the programming side of things, as well as just some other exercises to substitute and find more tolerable variations of in his case, squatting. Thankfully, deadlifting wasn't affected, so we were able to kind of continue training that fine. But yeah, there's knee pain comes in all sorts of shapes and sizes, and there's a huge spectrum.
Yeah, definitely. I guess what was the intervention, if you don't mind? Like, how did you essentially treat this powerlifter that came to you with the like your client that came with 7 out of 10 pain?
Sure. So, in this case, when he got the knee pain, he was actually out of town, so I couldn't physically see him. Thankfully, he was able to get in an appointment with a clinician that he trusted, like very early on, and they did assessment, and they kind of ruled anything out to make sure there wasn't anything that we weren't catching, and they determined it was just a matter of like overuse. So in this case, because it is an overuse type situation, now it's kind of like within my my wheelhouse to find whatever he can like tolerate, and what he can't. So we early on, it just started off with very low level exercises like banded leg extensions and body weight squats. So, oh yeah. So I'm remembering things more clearly now. What we did was we used body weight squat as a gauge to kind of find um, whether he was able to tolerate certain ranges of motion. And we found out that in his case, um, there wasn't the range of motion that was fairly pain free for him was very minimal. So we determined that it wasn't worth doing something like a reduced range of motion squat, like a pin squat, for example. Um, but we found that with with body weight squats, he was able to kind of as the days went on, he was able to tolerate that more and more. And then when he was tolerating body weight squats just fine, I eventually loaded him up with goblet squats. And then I also played around with more um, single leg like split squats to see if that made any bit of a difference, but that a lot of those ended up being too aggravating on his knee compared to just bilateral body weight squats. And so I figured we'll just focus most of our attention there. And so when he was able to kind of tolerate over 20 kilos of goblet squats consistently, I then put him on to just regular barbell back squats, and we started very conservatively. And the way I kind of approach things when it comes to using the barbell lifts for rehab is, I find there tends to be like a lot of lifters who say that they can't, for example, squats. What they really mean is they can't squat like a certain weight. And so I've had I've had people where they're able to squat the empty bar just fine, but then they load up a plate on each side, and suddenly their pain goes from like 0 to like 5 out of 10, and then it's like, oh yeah, I can't squat at all. But then they don't realize that there's weights between that. There's weights under like a single plate. So in his case, we started him off very conservatively, just like uh small weight increments. And we found that his day-to-day pain just uh, it started it started improving significantly. And then because a meet was coming up, one of the conversations I like to have with people I'm working with from or powerlifters I'm working with from the rehab side of things is sort of their particular risk tolerance. And so because oftentimes when it comes to just kind of dosing the amount of weights or volume or whatever parameters, it's just a matter of there's a lot of uncertainty. So obviously if we push a lot, we have a greater chance of getting back to previous strength levels much quicker than compared to if we just make, just small 5 kilo jumps every single week. But the caveat is we're also more likely to run into flare-ups because we push too hard too soon. And so this is a conversation I like to have with my with my lifters and or people that I'm working with to just gauge how much risk they're willing to tolerate. And in his case, because we were leaning into meet and he was um fairly competitive in his class, we decided that okay, we'd push more aggressively. And so I gave him essentially a pain cap. And then initially I was something else that I do when I'm working with lifters and I'm building them back up to the previous strength levels is I also give them progression caps. So I say, for example, it might be like, 3 sets of 5 at RPE 6, but a progression cap of like 15 kilos. So even if things are feeling really, really good, let's not push over this much. And I just find that helps people from suddenly having this huge spike in training load and risking a potential flare up. And so yeah, it was a combination of tolerating. I think we set it at 3 out of 10 pain. So as long as it was 3 out of 10 pain, then that he was okay to push, and then just making sure that he was able to um having the progression caps. And the other thing too is he with his primary, secondary, and tertiary days, we made sure to put most of the stress, like most of the volume and stuff on the primary day. So that was the most stressful on the knee. And then with his tertiary and secondary day, I put more restrictions in terms of rate of progress. So for example, while we might be able to progress, let's say the primary day by like 1 RPE or like by, I don't know, 2.5% every week, the secondary day might be even less than that, and the tertiary day I believe we didn't progress more than, it was like every 2 or 3 weeks before we just added more weight to that. And then just a matter of slowly over time, we were able to build back up to where we were. And actually, in his case, it wasn't slowly. It was we kind of pushed things. We tried to get his first. We tried to get his primary days back up to previous volumes and intensities that we were using before. And then our goal was to get the secondary day up to par, and then eventually the tertiary day. And so this is a span of over, I believe, 6-ish weeks, and then he was able to tolerate the last few weeks leading into meet prep just fine, and able to hit a squat PR on meet day.
Yeah, awesome. I guess in terms of your programming with that client in that case, then I know you said you were shifting a lot. I guess a lot of the primary focus being on the primary squat day. It sounds, I guess, more or less the question would be, what are your thoughts regarding, I guess, load management versus, giving accessories that will potentially, I guess, obviously based on the situation, giving accessories that will help what the client's feeling. So I guess in this case, I've got a client that I'm seeing at the moment that has a very similar bilateral anterior knee pain. But I know that it's mainly from the position that they are in when they're squatting and how they squat, how they deadlift, how they bench press, that is causing this chronic bilateral knee pain. So I guess the approach that I've taken with them would be more adding accessories or altering the accessories that they've got in their program with a few technical changes in terms of, center of mass shifting, things like that, versus, load management, if that makes sense.
Mm-hmm. So that's a really good question. That's something that I've definitely thought a lot about. It's like at one point, because as physios with or as clinicians with the combination of like programming experience as well as just like our knowledge of rehab exercises, to what extent do we use either or. And in this case of my particular client, we were almost forced to do a load management approach anyways, because his capacity to tolerate loads on squat was very minimal from the get-go. Usually when I'm working with someone, I like to meet them where they're at functionally at the. So if for example someone is able to tolerate 2 or 3 days of squatting, then my as much as possible I like to lean away from pulling them back right away, especially as and a lot of times people they're following a program, or they might be training to meet, or it could be like the it could be that load management isn't an option. And so I I mean, it's hard to say specifically without a specific case to 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 talk about. But I would say, like, if possible, like I always like to see if we were able to kind of get by with the least invasive approach. So if I could just give him an exercise, or for example, like something like a Spanish squat or an isometric that will just, suddenly now he's able to tolerate the his normal program without needing to change anything from that, then that'll be the way to go first and foremost for me. Um, but yeah, it's definitely a fine balance. And I know one of my biases is I tend to lean more towards the load management approach, because the type of people that I tend to see are like um usually other like power lifters or my own clients. But it's sometimes where um I'm just organizing my ideas.
All right.
So sometimes it's not an option, because maybe it's like a coach referring a lifter out to me, and they determine that what they need in order to progress on squats is like these 2 days or these 3 days with this specific amount of volume. And so if we just do a load management approach where we pull back, it's very well possible that when we build back up to what they were doing before, maybe they're still not able to tolerate what they need in order to make progress. So in this case where a total individual's the total stimulus required to make progress is much higher than what they're able to tolerate, then that's a case where I kind of dive more into kind of the more biomechanical side of things and explore different movement options, have like a um, explore different technique possibilities. And when it comes to technique, just in some cases it could be a temporary technique modification, or in some cases it might be like, okay, this is the technique that we need to use because this is what's going to let you to tolerate the workload that you need in order to make progress. And yeah, so I guess circling back to your original question, as much as possible I try to give them the least invasive option first, and then when that kind of tends to fail, that's when I'm like, okay, we need to like pull back or do something else from the load management side of things.
That's really good. I guess I resonate really quite a lot with that too, because that's, I mean, as both me and the other two exercise physiologists work with all the athletes that we see, we definitely take that least invasive approach and integrate our exercises or the things that are going to work really well, in our opinion, as best we can into the program without, hindering their performance ability. Yeah.
Yeah, so it's nice to see that even though we both come from different educations, different parts of the world, that we kind of we're all converging on kind of like a similar approach. And I'm sure there's subtle differences in how we approach things, but I think the underlying like principles when it comes to treating and rehabbing people, especially like a knee pain case, is probably a lot of similarities. And I feel like that seems to be the case with what I'm seeing with in the rehab side of things, is a lot of people are kind of converging to this point where we understand that like load management is an important tool, but also there are biomechanical things that we can do. And even though there might not be specific evidence for some of the things that we do, for example, there's no specific evidence that the combination of sets, reps, and RPE that someone needs to make progress is the way to go either. So it's important to look at everything as a whole and understand that in our toolkit, we instead of just being pigeonholed into load management or just like corrective exercise as the only way, we have all these other tools, and another one that is that we didn't talk too much about is sort of like temporary technique modifications or cueing, that and in some cases maybe that's all they need, and suddenly someone can tolerate squatting way more than without. Yeah.
Yeah. No, I think that's, I guess you basically hit the nail on the head. It is just another tool in the tool belt at the end of the day. And like you said, we're different parts of the world, but aiming to get the same thing in a similar method, which is really quite interesting there.
Okay. That'll just about beat us for time. So thanks for coming on and chatting to us, Melnard. Appreciate it. I hope it's not too late.
Thanks for having me.
So,
No, it's fine.
awesome, man. Well, good chatting to you. Hopefully, we'll get you on the pod again soon, and we can sort of flesh out more ideas, and we'll catch
Yeah,
up,
for sure.
see where you're at.
I'd be interested in chatting more about like specific case studies and kind of more specific interventions, and see how we, like, even though we might have the same sort of underlying ideas, the execution and the specific like nuances behind that, I'd be 100% interested in fleshing that out a bit more down the road.
That'd be cool.
I think it'd be very similar but different at the same time.
Yeah, yeah.
Sure. Well, that sounds good. We'll look forward to. We'll have a chat again soon, and hopefully
Sounds
we'll
good.
get more of an update of how your coaching's going, how your lifting's going, and see if you're registered by then or however the
Yeah, hopefully.
So that sounds good, man. Thanks for joining us again.
Awesome. Nice meeting you guys. Thanks for having me. Love what you guys are doing, and yeah, hope to chat again.
Sounds good, man. Thanks, dude. We'll see you later.
Yeah, take care.